The aim of this teaching video is to give some pointers on how to go about supervision or line management of junior colleagues. It's something that most seniors working within the NHS have to do, but we get very little teaching ourselves on how to actually do it. So, what are the general principles of providing good supervision or line management of our junior colleagues? Firstly, the setting. The setting should be comfortable, free of any interruptions or noise, free from mobile phones, bleeps and other colleagues coming in inopportune moments. All supervision sessions should be scheduled at regular intervals, and our junior colleagues should be aware of when they're going to happen. This also helps to decrease anxiety levels between sessions, and when our colleagues know that they have a specific time to discuss difficulties, they can contain their anxieties better. You need to ensure confidentiality at the beginning of supervision and make sure that you do not discuss issues outside of supervision or discuss other colleagues, for example. You need to make sure that your junior knows that it's not necessarily part of an assessment of them, unless of course it is. You should also be keeping a record of the topics discussed in supervision, and a colleague of mine, for example, sends an email to their junior after each session outlining what was said. Hi Giles.
Hi.
I mentioned to you last week, didn't I, that I wanted to discuss certain things about the job in this supervision session.
Yeah, you did, yeah.
Yeah, okay. Do you want to just say to me, how you think the job's going so far in general?
Yeah, job's going fine, yeah, no real problems. Yeah, liking it, yeah, enjoying it. Yeah.
Good.
It's good, yeah.
Anything in particular that you like about this job?
I suppose the things I like, people have been very friendly, been very helpful,
Right.
which is quite nice, both on the team, and it's been quite interesting meeting the patients as well, so that's been interesting. So yeah, I've got a good range of experiences really, yeah, so it's been good.
Good, yeah.
Yeah.
Anything perhaps, you're not quite so keen on?
I suppose the thing that I don't look forward to in the week is probably the MRC psych course. I don't think that's very good, to be honest. Bit of a most time, but apart from there's ways around that, isn't there? So it's not too,
okay. Maybe we'll come back to talk about that a bit later on. We'll come back to that.
Yeah, sure, yeah.
And besides that, things sort of okay at home?
Yeah, no problem.
Yeah, no sort of stresses or strains or anything?
No, everything's fine at home, yeah.
And your health, is that okay?
Yeah,
Good.
fine, no problems. Yeah.
Okay, great, okay. A couple of things. I mean, so far you seem fairly knowledgeable about the subject. I mean, it seems to me that you've probably done quite a bit of reading and you seem to know a fair amount.
Okay, yeah, good, thanks.
And also, I've had good reports from the secretaries that you seem quite friendly and they seem to quite like you, and, you seem to get on with the staff.
That's nice to hear. Yeah, that's nice, yeah.
Good. There are, however, a couple of things today that I do want to discuss with you that I'm a little bit concerned about.
Oh, right, okay.
Okay.
Yeah.
The first thing is, really it's about you answering your bleep. Okay. Because I've noticed, you've been working for me for 8 weeks now, and I've noticed you've been late for the ward round about 3 times. You've been about half an hour late, and we've had to bleep you. And you haven't answered your bleep straight away. And the ward manager phoned me last week, and they've had some concerns as well about you answering your bleep. And they've said that on the whole, they know that if they bleep you once, you're not going to answer. And they always have to bleep you twice and sometimes even 3 times before they'll get a response. Were you kind of aware of this?
Yeah, I've noticed that they do seem to bleep an awful lot, which seems a little unnecessary, I think, really.
Okay, so what do you mean it seems unnecessary then?
Well, I think if not answer my bleep, then it probably means that I'm somewhere else and I'm busy, doing something that's important somewhere else, really. So I think it's a sign, really, that they're not. They're just pestering, really. I think that's what's happening, really. They're just because often it's just things like drug cards or trivial things that can be done at some other point, or could be done by another doctor who's on the team anyway, who's around anyway, but they sort of just keep on and just take it very.
Well, I mean, I'm not sure that that's acceptable, really. I mean, what if it wasn't about a drug card? I mean, what are the sorts of things that you could be bleeped about? What about more important things? I mean, what if they were bleeping you to say that somebody was acutely unwell? They'd maybe had a dystonic reaction, or somebody had fallen over and hurt themselves. I mean, what if they were bleeping you for something more serious?
Well, yeah, I mean, I do get there in the end, I suppose. I suppose if it was more serious, then I ought to have answered it.
Yes, you're not going to know, essentially, are you?
No.
And sometimes, okay, your bleep does go off, and it is about something like rewriting a card, and it isn't urgent, but then you need to answer your bleep first to establish whether what they want you to do is urgent, don't you? And then you manage your time accordingly. But I think the important thing is, if you don't answer when you're called straight away, you could be compromising patient care and safety. And I think that's important, really.
I suppose there's always going to be someone around if it was something really important.
Well, no, that's not the case either. There aren't always people around, and I think it's, in terms of you being a professional, carrying your pager, you should answer the pager as soon as it goes off and as soon as you're able to get to the phone, really. Okay. So that is an important issue.
Yeah. Okay. Yeah.
And another thing I've noticed, I've had a look through the medical notes recently, and it seems to me that although you're writing in the notes when we do the ward round every week, you don't seem to be making many entries outside of the ward round, and I get the impression that you're not really seeing the patients outside of the ward round.
I see some of them outside the ward round, so it depends who's around. I mean, obviously, if they're sleeping or if they're out on leave or things like that, then obviously I can't see those patients. But I do see some of the patients in between times and just check in and see what's happening.
I don't think them being asleep is a very good excuse, but I would expect you to see the patients at least once, but usually twice a week outside of the ward rounds. I mean, you're a junior psychiatrist. It's a fantastic training opportunity to get to know the inpatients, to talk to them, to find out more about them and their lives and so on. And it's the the time in your training when you get the most time to do that. So I think it's important that you do see the patients more often, and certainly when people are acutely unwell, really they expect to see a doctor every day. So I think we need to set a goal that you see all the patients at least twice a week outside of the ward round.
As well as the ward round? Okay.
Yes.
Okay.
Yeah, okay. Okay, and then finally, just to go back to the MRC Psych course that you mentioned, you're not very impressed with that?
Not really. I mean, I mean, before I came, I'd spoken to one of my friends who'd been on this rotation before, and had said that the course isn't really up to very much and not really worth going, to be honest.
Oh, okay.
And yeah, so I've been a few times, and it's not been that impressive, really. I think I found that really it'd be better for me to study by myself, really, rather than go to the course, really.
Oh, okay. Well, I mean, I I can't say I share that view, because the other trainees I've spoken to have actually said the course is fairly good, actually. There might be one or two lectures that perhaps, could have been a bit better, but on the whole it's fairly well received. I've actually got a copy of the register for the last 5 sessions, and I noticed that you've only actually been to one of the last 5 half-day teaching sessions.
Okay. Yeah, maybe I might not have signed one, but yeah, I've certainly only been to 1 or 2. Yeah.
Okay. So I mean, I guess that begs the question: what are you doing with your time? Because the study leave that you're given is for attendance at the course, and that's quite specific. So.
Oh, right. I thought it was study leave that I could just use to as long as I studied in that time, it'd be okay.
No.
No. Okay.
No. The study leave is for attendance at the course, and you're actually expected to attend 70%.
Right.
Of the lectures.
Even if they're not very good.
Well, I mean, I guess you don't know that they're not very good yourself, do you? Because you haven't actually been. And you do get the opportunity to give feedback on the lectures. So there is a feedback form at the end of every lecture, and you know, if you think it's not very good, you can write your feedback and say. But I think it's important that you are attending 70%. It may have implications later on for you being written up for your training posts and for your exams and so on.
Okay. Well, I'll give it another go, yeah.
Okay,
yeah.
All right. So, shall we just summarise then the areas of concern? Do you want to sort of summarise so I can just check that we're on the same wavelength?
Well, we talked about the course, so I need to go to more of the course, 70% of the course.
Yeah.
We've talked about the bleep, so I need to answer the bleep first time.
Yeah.
Okay. And we've talked about seeing patients.
Yes.
So I need to be seeing all the patients.
Yes.
At least twice a week.
Outside of the ward.
Outside of the ward round, so 3 times a week, yeah.
Yes, that's right. And what I want to do is, obviously we meet up weekly anyway for these supervisions.
Yeah.
And then if we set a date in 4 weeks from today, that we'll meet up and we'll specifically go over those areas that we've discussed today.
Right, okay.
And I shall again get a copy of the register for the course, and I shall have a word again with the ward manager to see whether they think your answering your bleep has improved.
Right, okay.
And I'll have a look through the notes as well to see whether you've been seeing the patients.
Okay. Yeah, we'll do that, yeah.
All right, okay then, Giles.
Okay, thanks.
Next, here are some tips to ensure a good method. You should be finding out what your junior colleague already knows and building on that knowledge. Your verbal skills can include firstly using open questions at the beginning. You may then need to use more closed questions as the session progresses. You may also use clarifying or summary statements to check back with your junior that you both understand what is being said. Alternatively, you may ask your junior to summarise themselves exactly what has been said. As a senior, you should remain empathic and respectful at all times. If commenting on attitudes or behaviours of your junior colleagues, you need to make specific statements. Rather than saying, I noticed that when you talk to the patients, you sit next to them, they often stare out the window. You don't seem to be very good at it. Do you lack confidence? Would be better put as, I noticed when you went to talk to Mrs. White yesterday, you sat down beside her. She then looked out of the window and the conversation didn't really get off the ground. Is there another way that you could have approached things? And lastly, as a senior colleague, you may sometimes want to share your own experiences with your juniors.